Getting vaccinated is your duty. The purpose of my speech is to persuade my audience about how it's your duty to your community to get vaccinated to protect yourself and those around you. By getting vaccinated, you can protect your community from harmful diseases that could kill people or even maim them. And most of the diseases are curable, so it's important that we do get vaccinated to protect everybody. So my first point is, with anti-vaccination movements on the rise, more preventable diseases are being spread. So these are things like polio and the measles and other things like that. So diseases like polio and smallpox, for example, are completely eradicated with the use of vaccines, but the problem is that there are many reasons today why people are not getting vaccinated. And this can be, for example, that they can't afford to. Maybe they don't have access to health care. A lot of third world countries have issues with high rates of diseases because their citizens cannot get vaccinated. Another reason is that people simply choose not to. A lot of people live in developed countries and they can completely and totally get vaccinated for even free with their healthcare sometimes, and they just choose not to. And this can be because they've been misinformed, or maybe they just think it's unsafe. And the reality of it is that getting vaccinated is the safest thing you can do, not only for yourself, but for everybody around you. So if I go back to my point about smallpox, we all know, because we all took American history, smallpox was an incredibly deadly disease, and it wiped out entire populations of people. We obviously wouldn't want something like that coming back around again, so we definitely want to stay vaccinated against things like that, because smallpox is not the only disease that could wipe out communities. And we should all know with COVID about how one person gets it, and within a year it had spread all over the world. So getting vaccinated is a really good way to stop the spread of diseases before they get everywhere, because as we all know, once they spread, they're everywhere and it's harder to keep yourself from getting them. So there's a list of vaccines that children get at birth to prevent diseases from spreading, and without them, they're at high risk. And children and the elderly are some of the people who are at highest risk for these diseases whenever they are spreading. This is why there's a large number of vaccines that are specifically for children and the elderly. So children, from unicef.com, there's an entire list of vaccines for children to get, and these mostly range from the first year of birth. And these are really important for these kids to get them because, again, babies are some of the most vulnerable to these diseases. And so cases of measles and other diseases that can be cured with vaccines are on the rise in affected patients. So there's a case right now, and this was published by the news outlet, about a man in New Orleans who just came down with the measles, and this happened this past week. And if you ask me, there's no reason why in 2025 we should have cases of the measles going around. This is a disease that we know how to cure, and it's vaccinated against, and it shouldn't be spreading. And it's spreading because of the lack of vaccinations. So many people think that vaccinations are useless because they themselves have not personally been affected by their decision to not get vaccinated, and there can again be many reasons for this. The first one is herd immunity. Cleveland Clinic defines herd immunity as enough people being immune to a disease that the infection cannot spread from one person to another. So this is if a lot of people are vaccinated and one person's not, and that one person is in the group with the people who are vaccinated, it's going to be harder for that person to get sick because he's surrounded by people who cannot get the disease he's not vaccinated against. So it's going to be harder to transfer a disease to someone who is around a ton of people who can't get it. How is he going to get the disease? Versus if a group of unvaccinated people have another unvaccinated person in the group, it's going to be easier for them to transmit diseases back and forth because none of them are protected against the disease. So people claim that vaccines don't work because sometimes they still get sick when they get them, or a lot of people will say, I still get sick if I get my vaccine, or I don't get sick if I don't get it. And this again goes back to my point of herd immunity, and it also touches on my new point of vaccines are not always meant to keep you from getting sick. A lot of them, like the flu virus, they are just meant to help you strengthen your immune system so that if you do end up getting sick, you have a better chance of recovering and not ending up in the hospital long term. Because a lot of people do end up in the hospital with the flu. My husband is a nurse, and he has so many cases of not even just elderly people, but just people in general in the hospital with the flu because it can be a serious disease when you're not vaccinated against it. And this, again, is why it's important to stay vaccinated against deadly diseases like this. So there are many misconceptions about vaccinations, and these all come from sources of misinformation. There are many public figures that spread misinformation about vaccinations, and this has been going on for centuries. So I will explain Andrew Wakefield. He tampered with evidence, and he made up a bunch of lies about vaccinations. So a lot of people may know of the idea that vaccinations cause autism. This is an idea that's spread, and this is a huge reason why a lot of people won't vaccinate their children. So Andrew Wakefield, he did studies on children. He took blood samples from children, and he paid them each $5 apiece to take their blood sample at his son's birthday party. And this in itself is an instance of unethical practice, because children obviously can't consent to a thing like this. And he said in his studies that there was a correlation between the blood samples and autism in children, and of children who were vaccinated. This has been proven false. He tampered with his evidence because he made the claim that vaccinations can cause autism, knowing that he couldn't back it up. So he lied, and he made up saying that they did. And the National Library of Medicine even redid his study and said that it was false. So no causal link was established between MMR vaccine and autism, as the data were insufficient. This was accompanied by an admission by the Lancet that Wakefield had failed to disclose financial interest. He had been funded by lawyers who had been engaged by parents in lawsuits against vaccine-producing companies, and this is by the National Library of Medicine. So again, he made up lies, spread them out, and then all just to find out that the entire reason he made these lies up is because he was being funded to do so. So this is harmful again because Andrew Wakefield convinced a lot of people to not get vaccinated. And babies have a list of vaccinations that they should be getting, with the majority of them occurring at 6 months old. Mental delays such as autism are thought to be developed in the womb. We have not even proved that autism is developed once the baby's born. So while there is a connection between autism and vaccines, there's no causation, because you cannot prove that one causes the other, because we don't know that. So despite what misinformation may suggest, getting vaccinated not only decreases your spread of diseases, but it also decreases it to everyone else. So you're not only helping yourself, but you're also helping those around you. Getting vaccinated helps keep yourself and those around you protected from a plethora of dangerous diseases. And the final note would be, misinformation about vaccination costs lives.